The following segment is sponsored by Springfield Clinic.
Joining us this Wellness Wednesday is Dr. John Bells of Springfield Pediatrics, and today we're talking about RSV. Thank you for joining us.
Happy to be here.
Now, along with cold and flu season, we do hear at this time about RSV, especially in babies. So just what is RSV?
Yeah, so RSV stands for Respiratory Syncytial virus. So it's a type of respiratory virus that affects especially the elderly and young babies. So as a pediatrician, that's why I care about it, because it's a common cause of hospitalization in young infants.
Yeah. And what are the symptoms of RSV?
Yeah, so RSV is like a typical respiratory virus that it causes, in most people, it causes upper respiratory symptoms, including runny nose, cough, and congestion. In young infants, the illness can start off like that, but it also can go down into their lungs and affect their breathing. And that's where we get concerned, and that's a common cause of hospitalization. If they have respiratory distress, where they have retractions, where their chest is caving in and out, and they're not able to keep up with the demand, or it can drop their oxygen levels, where they need oxygen supplementation. So it's a common cause of hospitalization, and we worry about those respiratory symptoms in babies.
And who should get an RSV vaccine?
Yeah, so there are new vaccines that have come out in the past 2 to 3 years that are targeted towards the elderly and young babies. So there's 2 ways for young babies to get a vaccine. One of them is for pregnant moms to receive a vaccine in their 3rd trimester, and then those antibodies can cross the placenta and then provide protection to babies. Otherwise, a baby can receive a shot in and of itself. And the immunization for babies is actually preventative antibodies. So it doesn't work in the way a traditional vaccine works, where we use the body's own immune system. In this case, we're just providing antibodies that last for around 5 months to the most at-risk individuals. So in that case, this is babies that are younger than 8 months entering their first RSV season. So RSV season is typically is starting up soon, starting in November and December. So any infant younger than 8 months of age entering now is eligible to receive the shot, and it's preventative antibodies.
And where can we learn more about RSV and the vaccine?
Yeah, so I think your pediatrician is going to be a good resource. So definitely going to that doctor that you have a relationship with in terms of getting information. And then the other place that you can get information from is the CDC website. So your pediatrician can be a resource for discussing the Beyfortus or the RSV shot. And then anyone who does not have a pediatrician, you can call our office at Springfield Clinic, because we are accepting new patients. But in a pinch, also the public health department has immunizations at lower little cost to people.
Alrighty, thank you so much for coming in and providing us with this information.
Okay, always a pleasure.
Thank you for watching. Make sure you subscribe to our YouTube channel and be sure to watch more videos from Fox, Illinois.